Vitamin B1, also known as thiamine, is an essential nutrient that our body requires for normal functioning, particularly playing a crucial role in energy production and nerve function. As a water-soluble vitamin, vitamin B1 is not stored in the body and needs to be regularly consumed. Basic functions of vitamin B1. Vitamin B1 is primarily involved in energy metabolism and neurotransmission. Energy metabolism. Vitamin B1 is a part of the enzymes necessary for generating energy from carbohydrates. It also participates in the metabolism of fats and proteins. Vitamin B1 functions as a coenzyme in the enzymatic reaction that converts glucose into energy, known as glycolysis, occurring in cells throughout the body. Therefore, vitamin B1 is crucial, especially in tissues with high energy demands, such as muscle tissues and the brain. The brain, in particular, heavily relies on glucose for energy supply. So a deficiency in vitamin B1 can affect energy supply, potentially leading to issues with cognitive function and neurotransmission. Neurotransmission. Vitamin B1 assists in the function of enzymes required for the production of neurotransmitters, allowing the proper functioning of the nervous system. Specifically, it acts as a coenzyme for the enzyme choline-acetyltransferase, which is essential for the production of the neurotransmitter acetylcholine. Acetylcholine plays a vital role in both the central nervous system and the peripheral nervous system. In the central nervous system, it regulates cognitive functions such as learning, memory, attention, and arousal. In the peripheral nervous system, it regulates bodily functions like heart rate, digestion, and salivary secretion. The enzyme choline-acetyltransferase, which is necessary for the production of acetylcholine, combines two substances, acetyl-CoA and choline, to create acetylcholine. In this process, vitamin B1 functions as a coenzyme, assisting in the chemical reaction. Therefore, a deficiency in vitamin B1 can hinder the production of acetylcholine and potentially impede the normal functioning of the nervous system, leading to problems with cognitive function and neurotransmission. Acetylcholine is particularly important for learning and memory. Reduced levels of acetylcholine may lead to a decline in cognitive function, especially in memory and attention. Patients with Alzheimer's disease, in particular, show decreased levels of acetylcholine in regions involved in memory, such as the cerebral cortex and the hippocampus. A deficiency in vitamin B1 may further contribute to a decline in memory and attention. As a result, assessing vitamin B1 levels is necessary in cases where cognitive function decline is suspected or in the diagnosis of dementia. Possible causes of vitamin B1 deficiency. Vitamin B1 deficiency can occur in various situations. Here are some main examples. Poor diet. Vitamin B1 must primarily be obtained from the diet. It is found in various foods such as whole grains, pork, seeds, nuts, and legumes. A lack of these foods or an imbalanced overall diet can lead to a deficiency in vitamin B1. Alcohol dependence. Long-term heavy alcohol consumption can hinder the absorption and utilization of vitamin B1, potentially leading to a deficiency in conditions like Korsakoff Syndrome. Digestive absorption disorders. Digestive tract conditions like Crohn's disease or celiac disease can inhibit the absorption of nutrients, including vitamin B1, leading to a deficiency. High expenditure states. During periods of high energy consumption, such as pregnancy, breastfeeding, growth phases, athletic training, fever, or post-surgery, the demand for vitamin B1 increases. If the supply does not meet this demand, it can result in a deficiency. To avoid these situations and ensure sufficient intake of vitamin B1, consuming a well-balanced diet is essential. Additionally, some medications may impact the absorption or metabolism of vitamin B1. Loop diuretics like furosemide. These drugs help eliminate excess water and electrolytes from the body, including the potential elimination of vitamin B1. Alcohol. Alcohol can interfere with the absorption and metabolism of vitamin B1. Long-term excessive alcohol intake may lead to a deficiency condition, like Korsakoff Syndrome. Antacids, H2 blockers and proton pump inhibitors. used to reduce stomach acid secretion, may inhibit the absorption of vitamin B1. Metformin, this drug used to treat type 2 diabetes, has been suggested in some studies to inhibit the absorption of vitamin B1 with long-term use. Some chemotherapy drugs. Certain chemotherapy drugs may decrease vitamin B1 levels in the body. People taking these medications should be aware of the potential for vitamin B1 deficiency. If you are on long-term medication or already have insufficient vitamin B1 intake, it is crucial to consult with a doctor or pharmacist. In conclusion, vitamin B1 is essential for brain and cognitive function. To efficiently consume vitamin B1, consider foods rich in it, such as whole grains, pork, seeds, nuts, and legumes. However, as pork consumption might become challenging with age, exploring other vitamin B1-rich alternatives is recommended, including foods like whole grain bread, brown rice, oats, corn flakes, sunflower seeds, flax seeds, peanuts, lentils, fish, especially mackerel and salmon. Fermented foods like natto and brewer's yeast can help meet the required intake. Supplements might be appropriate for some individuals, but it is essential to consult a medical professional before considering them. Vitamin B1 is water-soluble, so excess intake is generally excreted from the body without significant harm. However, some people may experience side effects, such as allergic reactions with excessive intake, making adherence to recommended amounts vital.